overcoming technical difficulties. Tiger will be hopping on momentarily so we can have the deck. So here, we'll do it old school. We're going to go manual. We will be starting today's presentation for Root U, brought to you by Dr. Christina Rahm shortly. But in lieu of procrastinating too much, so we can get into today's educational topic, as I watch the number of participants increase well past the number of attendees that ever show up for me to do any conversation on a Monday or a Tuesday. We will start with the medical disclaimer. Now, Dr. Rahm says it doesn't matter if I do the medical disclaimer because I'm not a doctor. But we're going to do it anyway because this information is provided for educational and entertainment purposes, and it's not intended for any use as medical advice or a substitute for the medical advice of a healthcare professional. I won't just say a physician. You should not use this information for the diagnosis of a health, fitness problem, or a disease, a syndrome, or a disorder. I added that part. And you should always consult with a doctor or a healthcare professional for any medical advice or information about a diagnosis or treatment. And that's actually true, because when we look at the disclaimer on this, you should talk to doctors, because if you are an attendee of Root U, you are now more educated than the doctors that you probably want to talk to. And you should reach out to them because they need to hear and learn from you. Danielle's here. Danielle and I just spent a couple hours together doing an interview on Friday of last week that I think she just put on Rumble that got her banned on YouTube. So there's that. So we got the medical disclaimer. How come there's a bar on the side? Oh, I guess that's part of the slide. All right. Tiger, we got this one out of the way. Should we move on to the next one? Today's topic, like I said, this was going to give me a headache. Migraines. So, well, I am not very good at talking about this subject. We are to the point where I am going to try to find the good Dr. Rahm and let her take over. So give me one moment. I will be right back.
All right. So today we're talking about migraine disease. First of all, I want to say hi to everyone. I think Clayton read the medical disclaimer. As you guys know, we're not here to treat or cure or diagnose, but we are here to teach people and educate people on different things so that we can educate our customers. And I think I'm pretty adamant. You guys probably know this, that I am not trying to cure people. No one can do that. You know, we're here to really help people throughout the world in different areas. And I keep getting questions on migraines, which is one of the reasons we're going to talk about this today. We do have case studies on this, so I'll touch upon that as well. But let's talk about what a migraine disease is. It's a headache characterized by, basically reoccurrent attacks. And some people only have 1 or 2 migraines in their lifetime. I have personally had some myself, and they are really severe. So when people tell me they're having an issue with migraines, I know exactly how they feel. It's horrible. Every time I've gotten one, I feel like I'm going to get sick to my stomach, and my head is killing me. And I think, oh my gosh, what am I going to do? But I don't have them very often, like I said, and some people have them a lot. So we're going to discuss possible solutions and how we can help people throughout the world on that. The pain is caused, just so you guys know, by activation of the nerve fibers within the wall of the brain and the blood vessels. So it's not something that you're imagining. These things travel inside the meninges, which are 3 layers of membranes that protect the brain and spinal cord. So this is really something that causes a lot of issues. And it's not something to laugh about. When people tell me they're in bed with a migraine, I'm like, oh my gosh, I hope you're okay, because it is pretty miserable. So we're going to talk about different things that cause this and different diseases that can activate this. So please go to the next slide. We're going to talk about why this is something that has a variety of symptoms, because like I said, you have the pulsing headaches, you have the The physical activity, and I want to explain that too. A lot of people that have migraines, they can't stand the smell of things. They can't stand lights or sounds. And it's so bad that it's actually almost impossible for them to be in the light or for them to smell anything. It really is horrible. About 12% of Americans have this disorder. I think it's actually higher. And to be honest, after COVID, whether it's COVID or the vaccines, I'm unsure, but I know that there's a lot more migraines and a lot more issues that people are having with their head. Research shows that it's the 6th most disabling disease in the world. And what that means is it actually causes significant issues. This slide says it lasts 4 hours or even days, but I know people that have experienced it longer than that. I know people that have a shorter duration of that as well. So it is something that impacts every person differently. And we talk about that. We all have different reactions to things. So what type of headache is a migraine? Migraines have over 150 types of basically reactions or headaches, however you want to diagnose this. You have this primary headache and you have a secondary, and everyone's different. There's not a blood test to really show this or imaging. However, science is coming out with different things that can do this. In fact, many of you guys know I was just in Italy and we talked about some of these issues with migraines. A lot of people don't know this, but when I go into Italy, I don't just go to the Vatican or meet with the Pope or meet with the government. I go into scientific meetings. That's really the reason I'm there. The reason I've been knighted into different families and organizations and royalty is because I work on different projects. Always keeping in mind that the main reason I'm working on projects is the root community and solutions for the world. Always keeping in mind my center and my positive belief on following the light, following God, trying to do the right thing, but scientifically really trying to dial in how can we help people throughout the world, regardless of their religion, regardless of their political views, regardless of what's going on, because despite the war, despite the pandemic, despite all the economic issues that we have, we've got to come up with solutions for health. And we have more and more health issues, especially since the pandemic. I think a lot of this goes back to environmental triggers. And a lot of you guys know that one of the main reasons Root was created in Clean Slate, as well as the other formulas, was to really detox the body and support and bring really barricades to illnesses and really solve problems in the body by supporting what God has naturally made. But this is something, like I said, that's become more and more common, unfortunately. So one of the things people talk about when they talk about the different types of headaches is the aura. And that means basically a group of sensory, motor, and speech symptoms that act like warning signals. And that's really how you know the migraine's beginning. A lot of people can misinterpret it as a seizure, a stroke, or even a heart attack. Some people think it's anxiety at first, but this phenomenon happens for about 10 to 60 minutes, and it's really not fun. The symptoms are reversible, even though I want to tell you guys, because I want you guys to know I understand this. A lot of people think the symptoms won't go away. You know, you can see dots, sparkles, or lights. Some people can have blind spots in their vision, numb or tingling skin. Although I will tell you, there's some people that I've worked with that have numbness in their arms and hands, and I actually get that when I've had migraines. The speech changes, you have ringing in your ears, there's temporary vision loss for some people, jagged lines and waves, you feel really funny, you smell things. It's really, really scary. You also, that's why when people discuss this and they say, you know, I need to go home, I need to lay down, absolutely they do, because this is something that really is debilitating. It really causes a lot of issues. So let's talk about the types of migraines, because I want to really have you guys identify if you have these things. And I also want you to be able to know and be educated in case you're around people that describe this. I've heard some husbands say, I don't believe my wife's actually having a migraine. I think she just wants to lay in bed. I've heard some women say, I think my husband just doesn't want to go to work. No, migraines are a horrible feeling. So we've got to figure out why they happen and how we can stop this. And I already identified some of the issues, which are environmental triggers and heavy metals and different things that we're exposed to. But let's talk about the different types. Migraines with the aura is a complicated migraine. It happens in 15 to 20% of the people. I actually think that most people have this aura. And in some countries they say aura and some people say aura. I really think that most of you have some form of this. It creates it in a different way, because I do think it's implicating and attacking different pathways of the brain, and your mind is basically identifying this differently, and then your body is reacting differently because we each have a different type of DNA. We each have different genetics, and our bodies are handling this in a much different way. I think some people, when you go to migraines without head pain, they're called silent, but they actually can be even more harmful because you don't understand what's going on and you don't stop what you're doing. And all migraines can cause a lasting problem if you're not careful. When you read the data, it says that it's temporary and you're going to be okay. I actually think it can have long-term issues, which is why I think really detoxing the body, supporting the body, and giving the body what it needs is very important. If you look at a common type of migraine, which is the second part that talks about this, it really strikes without a warning. It just comes on like that. A lot of people have this slow onset and they see different things and then it happens. But some people, it just happens very quickly. And like I said, it's like you know you have to go in a dark room and you have to lay down and you really have to help yourself. Some people have a temporary paralysis with this on one side of their body. I kind of spoke about that earlier about me, that my hand and my arm will go basically numb. I actually have done a root U call before when I felt this, and it scared me a lot, but I knew I needed to get through the call. I don't recommend that with anyone. I think you need to turn your computers and your phones off, and you need to stay in a dark room when that happens. I've also had this happen on a plane, and that's not fun either. So I really want you guys to know, when this happens, you need to drink a lot of fluids. You need to really help your body be supported and give your body what it needs, which includes some of our products, in my opinion, because it really can help support your body during this time. We can't make it completely go away, but our goal is to minimize the time a migraine occurs, and then also to help the body gradually detoxify and get rid of heavy metals and different things that shouldn't be in the body so the brain can work more effectively. Some people have a retinal migraine, and that means you have basically a complete loss of vision. And how scary is that? I mean, that's really scary, and it's complicated for people, and it's not fun at all. And it can be a serious issue. This should always be reported to a doctor because it could be something else, or it could be a precursor to something else. So it's really important that you report it if you have things like that. Chronic migraines occur at least 15 days per month, which is horrible. We've actually had case studies with Root where we've been able to cut that duration down with people through supporting their bodies, helping them detoxify and get rid of heavy metals, and really supporting the fact that we're giving them the nutrients and minerals they need so that it can help their brains work better. I actually think when you look at the neurotransmitters and the neural pathways, that when you have heavy metals, I think this is a precursor and one of the causes of this, like I said earlier. So it's really important that you continue to get rid of it, because if your neurons and your pathways cannot get nutrients and minerals, and when you have heavy metals, they can't, right? When they can't get that, then your body is clogged up and your body reacts. And when that happens in your brain, that's a serious issue. That's something that you really have to attack. Migraines with brainstem aura, that is where you have slurred speech, vertigo, double vision, loss of balance. The pain affects the back of your head. It's really not fun either. Like when you look at these, I always say to myself, which one do I want to have? And the answer is none of them. But you definitely, some of them are worse than others. And that's why some people will say, well, I've had a migraine, like me, right? And then other people are like, well, I had a migraine and I couldn't leave my room. So remember that. That's because some people have serious issues and serious basically effects from the migraine, and some people don't have as many. So you have to understand that just because you've had a migraine doesn't mean you've had the same type of migraine as other people. Stratus migrainosus, that's a rare and severe type of migraine, and it can last more than 72 hours. It causes pain and nauseousness, and a lot of times people have to go to the hospital to get hydrated or to have pain meds and stuff during that time. So I know why I get so many questions on migraines, because it's such a big issue. And many of you guys know this, women that are fluctuating in estrogen, women that are going through menopause, women that are pregnant or have menstrual periods, this can be a reaction. Sometimes even oral contraceptives can cause that and worsen it. However, sometimes it can help it. So I'm just letting you guys know hormones are an issue, but sometimes it makes it better and sometimes it makes it worse. And that's why, again, you can't judge other people when they say they're in a lot of pain, because some people are when they have to deal with this. Drinking alcohol, especially wine or too much caffeine, can add to this. I would say, just so you guys know, the biggest trigger as far as alcohol would be wine and beer. Some types of alcohol like vodka and tequila do not have as many correlations to migraines. That doesn't mean I want you guys to go drink vodka or tequila. It just means I'm letting you guys know that there's more types of connections with this when you have wine and beer. Bright lights can induce it. And that's why, again, if you're on your computer, if you're on your phone and you're constantly moving around, you've got to minimize that. You really do. You have to get rid of things like perfume and paint and different other things that can trigger it, because it's a response that your body has that you've got to turn off those triggers. People that miss sleep, like me, also it can trigger migraines. I've noticed when I go back and forth between multiple time zones, you know, you guys see stuff on social media and you see things that looks like I'm having fun. And the truth is, I'll go last week, for example, 2 nights in a row, I had 2 to 3 hours of sleep maximum because of the
You're
different
always
things.
having fun when you travel.
Ted said I'm always having fun when I travel. He didn't sleep, I think, 1 or 2 nights either. But I slept a couple of hours and I, you know, woke up and my head felt extreme pain. Then I go out in the heat. So I'll give you an example. I had to go out to the meeting in the middle of Rome, and there's like 10,000 people there, and I was in the heat. It was like 89 degrees and I was so hot and my head was just pounding. So I just took a bunch of clean slate. I took a Restore and I drank water to really help me. And I tell you what, the Restore really kind of kicked it up for me and made me feel better. And I was very thankful. But the different pressures with the weather, so like when you're flying in and out of different time zones and you're not sleeping, or the weather's changing, like when I went from 90 degrees to 55 degrees in Nashville, Tennessee, that pressure can cause those things too. However, again, if you're constantly supplementing yourself with green tea, with water, with lots of trying to sleep, trying to really relax, that can help. But relaxing does not need to include watching TV, computers, or phones. I last night put on a candle by my bed and took a bath with I did oils and salt, and I even put some clean slate in my bath. And I felt much better after that because my head was hurting because of all the different time changes as well as lack of sleep. So anyway, just so you guys know, you've got to support your bodies during this time. Don't just say, oh, I'm going to push through this migraine. You've got to step back and really support your body and get rid of the triggers. Skipping meals can cause migraines, as well as a lot of sugar or cheese and salty food as well. So you got to pay attention to that. You don't need to take different things like MSGs. GMOs, of course, are not good. I wish I had this on the slide, but lots of wheat and lots of pasta, stuff like that is not good for headaches either. You want to stick to the proteins and the vegetables, and that will help quite a bit during these changes. You really got to pay attention to all these things. And I will tell you another thing, having sex during a migraine is not a good idea. You've got to limit that, and you've got to really focus on controlling the migraine. So let's talk about a protocol. And we get our protocols from the case studies that we have. We've had lots of doctors throughout the world helping people with migraines. Dr. Rahman is one that I would point to directly. You also have Michelle Davis and other doctors that are helping with this. But a lot of people do the clean slate. I want to say this. Clean slate can dehydrate you if you're not drinking water. You've got to drink water and green tea and lots of it. I say this all the time, but I really mean it. The case studies that we've had, a lot of them are doing 2 to 6 drops in the morning and evening when they're trying to specifically target migraines. And then they increase and they basically get up to 2 drops at 10 times a day. Some people in the protocol are going even higher. Some people are going lower. So you really got to work with this because, again, your neurotransmitters are really important, as well as your neural pathways in dealing with this. You've got to unclog those, you've got to clean those out, and you've got to support those. Another thing that people are doing to really help is zero in. I will tell you this. This particular protocol shows 1 in the morning for 7 days, then 1 in the afternoon after 7 days. So you're doing basically 2 in the morning and 1 in the afternoon. I didn't say that very clearly, but there are some people that cannot take zero in on migraines. Most of the people, once they start doing this protocol, it takes like 3 months to get them there. So I'm just going to tell you guys that don't just give up on the protocol unless you've tried it for a while. But there have been a few of the cases, I know because I've talked to the doctors, where they've actually been able to do the whole protocol except for zero in. So it just depends on the person. On the flip side of that, there's some people that the zero in was really the trigger to make it better, right? So you just have to focus on what that particular person needs and what will really help them. Most people are at least taking 1 zero in a day that have migraines, but then a lot of people are going up to 3 or 4 too. So I just want to make sure that I'm pointing that out. Restore, this says a half a sachet in the morning for 7 days, then then up to 1 in the morning. I can tell you for me personally, when I have a headache, Restore really helps me. And I will rub it on my temples or where my head is, and then I will take it. When I have a headache, I usually take 2 to 3 Restore a day. I do understand in this protocol, we're only saying a half to 1 a day. Again, this goes back to everybody's body is different. You have to listen to your body, you have to support your body, and then you have to respect your body. And I really want to talk to you guys about that today. I want everyone to understand that we live in a world where everyone's telling us who to be and what to do. I want to speak to you guys personally as a scientist, but as a person more than that. We are living in a very critical time right now. Everyone wants to tell everyone else what to do. Everyone wants to tell everyone else how they're wrong. I want to encourage each of you to listen to your body, to listen to what you want, and to try to be the best you can be. You're never going to be someone else, and you don't want to be. You definitely don't want to be me. I was talking about this last night with my husband, my amazing husband. I was sharing with him how much I missed him on the trip. Also, we were talking about, basically different things we had gone through in our lives and how it hadn't been easy. And I said, I know it looks like my life is easy when you look at the pictures that we send back. He knows my life. He knows when I travel, it's not that easy. He knows because he's traveled with me, and he knows how difficult it is. And he knows that, that I can get a headache just worrying about how it looks so perfect on social media and how it's so not perfect. And I've shared this with the Platinum group. I want to share this with you guys today. I'm taking a lot of control back in the next couple of months of social media, because I want people to see my real life and not just a picture. When you look at pictures, it looks like you're someone that you're not when you have makeup or hair done. When it's the real you get to see the real person. But let's go back to the topic. So my life's not that easy, and yours isn't either. We each have different bodies. We each have different lives. I want to encourage you to be the best you possible, because you are amazing. We all fail every day, especially me. We all have people gossip about us. We all have people talk about us. But what we have to be is our own self. That's right, Astrid. We have to be our authentic self. And we have to love ourselves for who we are and support our bodies. So when you guys get these headaches, just know that your body's talking to you. You have to listen, and you've got to take care of your body. And if people don't understand migraines, because I know that's an issue, it's like Lyme's disease, right? Or fibromyalgia. There's a lot of people that don't understand it, and they judge you because you have a migraine, and they think, oh, well, I've had headaches too. Support your body. Know that when you have this, you've got to find the right support, and then you've got to listen to your body and care about yourself. Take out the noise of what everyone else thinks or what everyone else believes, and just love yourself and listen to yourself. So going back to the protocol, Thank you, Suzanne. Going back to the protocol, you have half a teaspoon in the morning of natural barrier support. Some people take half a teaspoon twice a day or a whole teaspoon. I'm just letting you guys know because there are some studies that talk about vitamin D. I don't know if we have this in here, and how you need more, and that really helps support your body, as well as zinc and vitamin C. So I do think natural barrier support is an integral part of treating migraines. It sounds simple because it's just vitamins and minerals, but it is very important. The proprietary blend of Relive grains, they recommend 1 teaspoon in the evening. Sometimes I take 1 teaspoon in the evening, but usually I do mine in the morning. So again, you can decide where you guys want to do that. The immune defense shield, I think, is a very important piece of migraine treatment. Doing 1 capsule in the morning for 7 days and increasing to 2 capsules, 1 in the morning and 1 in the evening. I even have some people taking 4, and that's really made a difference in their life. So I don't want to forget that, because a lot of times when I'm talking to people, when I've met you guys, when I'm traveling, I forget to mention immune defense shield when it comes to migraines, and I shouldn't, because the latest research that we have and case studies that we have are showing that's an integral piece to really helping people. So let's go on and talk about, we have the protocols. We know that they're different with different people. We know that everyone is experiencing different types of headaches. We know that migraines are worse since COVID and since the pandemic. We know stress and environmental factors cause it, lack of sleep, and all of us are having lack of sleep because we're worried about everything going on in the world. So you've really got to take care of your body and love your body during this time. And when you have these migraines, give yourself a rest, let yourself take a break, and love yourself even more because you're taking a break, because it's okay. It's fine that you're sick. You've got to take care of yourself. We're going to talk about curcumin a little bit, which you guys know is one of my favorites. This is a clinical trial which looks at curcumin supplementation, and it looks at migraine patients. This is a double-blind, controlled, placebo randomized clinical trial, which is the best trial you can have that's individual. I do like multi-centered trials as well, but double-blind trials are really good. And this one looked at 44 women with migraines, and they received 500 milligrams of curcumin twice a day or placebo for 8 weeks. And it showed that basically the clinical symptoms of headache, severity, duration, concentration, frequency were measured at baseline at the end of the study, and it showed that it was improved when they were on the curcumin, which is a big deal. And that some of it was marginal improvements with the curcumin, but some of it was significant. So that's really important. And those of you that have migraines know if you can just have a little relief, if you can have a shorter duration, if you can have less inflammation, you feel a lot better. It's really important. I really think it is because of the pro-inflammatory markers and how curcumin really helps. There's similar studies, just so you guys know, with resveratrol. So even though wine is not good to have during migraines and can cause it, resveratrol is the opposite, because it's the isolate, it's not the whole wine, right? So we do know that helps. We also know that aloe vera helps, and black cumin seeds. So there's a lot of different things in Restore, which is why I think I lean on Restore when I have headaches, because there's a lot of things in there that can really help it. Another thing that can help, and I don't think we have it in the slide deck, are different things with the grains and the algae. And I'll talk a little bit more about that later. But a lot of times when you look at spirulina and the studies, and even chlorella and chlorophyllin at the microdosing, it can help support the brain. Many of you guys know that the pituitary tumor that I had, I used grains to really help me. And it was a small pituitary tumor, right? But then I was going to go into surgery, and I didn't have to. I did a lot of the grains constantly, morning and night. And I think that helps significantly. Your pituitary gland, they think, and the pineal gland are two of the reasons they think when they're disconnected, they can actually impact migraines. There's some basically functional med studies that are coming out. And I actually had one of the most famous pharmaceutical biotech CEOs was at the meeting I was at. And I know he doesn't do that anymore. He does nutraceuticals. He's focused on natural solutions. But if you look at history, he's one of the most famous men that ran these companies. He was also a scientist. And we talked a lot about the pituitary and the pineal gland. and about breathing in and breathing out, and about how you can meditate to really control different things like migraines and headaches and different types of autoimmune disorders. So I just want you guys to know, when you really are breathing in and breathing out and taking the time, even when you get stressed or you feel like it's coming on, you're opening the pineal and the pituitary. So it's kind of like it's starting to live. They explain it in science. This is going to sound really weird, so I don't want you guys to take this wrong. It's like the brain is having not an orgasm, but an ability to release basically toxins and then to increase pleasure, right, when you're doing that. So meditation and breathing are extremely important. I've talked about this a lot in the different studies I've seen in my career. The breathing and the spiritual healing and the meditation and the nutraceuticals, I would find that over and over and over in the studies when people would get better. So just remember, when you start getting stressed, when you're traveling a lot, even if you don't have time to sleep, you've got to do your breathing. And that is something that I do. When I start getting extremely stressed, I'm like, wait a minute, I've just got to breathe. And it's hard sometimes, like when you're scared or you're tired or you're in pain, you just want to say, I don't want to deal with this anymore, but you have to. You have to, Astra's saying, meditate. And I agree. You have to really think and focus on the positive and meditate through the symptoms and really help yourself. That being said, I want you guys to know, I do understand that you could meditate and you could drink water and you could get sleep and you still might have migraines, which is why we talked about the protocol. Remember, the protocol is something that you do for an extended period of time. It won't impact the migraines right away. We have had people say that it works within 2 weeks. We have had people say they have experience changes right away, but most people, it takes some time. So I just want you guys to know that. This one's about vitamin C, and I talked about this a little bit earlier. Your hormonal migraines, which a lot of times they call menstrual migraines, and your the ones that have to do with the aura, they are impacted by vitamin C. We do know that. Also vitamin D. And zinc. It's really important that you guys understand, even though these are basic vitamins and minerals, they're important. And I think the fact that we have the microdosing and we have the vitamins that have been cleaned and are very safe. We look at heavy metals. We look at everything surrounding those. It's really important that you understand, when you put that into water with lime, if you're taking like the natural barrier support, or when you're taking Clean Slate, which has the vitamin C that's very different in it, that was made in a lab when I worked on the Clean Slate, those are very significant to what you're doing. If you look at Restore and you look at Relive greens, those greens and the amazing formulation of Restore with the pure elements in it, those also have vitamin C in the turmeric, in the curcumin, in the resveratrol, in the spirulina. Those all also include vitamin C, even though it's not on the label. So I really want you guys to know how important it is. This particular study talks about the fact that 1,000 milligrams of vitamin C daily reduce the incidence and severity of migraines. And again, any of you guys that have experienced this, you know how important it is. Vitamin C is cheaper than almost any alternative. It's not as expensive. And even if it were, it wouldn't matter, because it's something that greatly impacts a lot of people by helping them when they have certain types of migraines. This does focus, just so you guys know, on neurogenic inflammation. It looks at vitamin C as a prophylactic agent, but I want you guys to know, in almost every area of migraines that I listed, vitamin C is known to really help, as well as turmeric curcumin. Even though I'm showing you particular studies, we know that it helps overall with almost all types of migraines. The next one talks about vitamin D, which I already mentioned to you guys. I didn't know if this was on here for sure. We know that higher circulating levels of vitamin D are associated with decreased migraine risk. In fact, if you look at people that have issues with vitamin D, which a lot of people with autoimmune disorders, are people that have cancer, are people that have gone through different things, have issues with vitamin D. I've talked about this a lot. Their body just doesn't really, they need a lot of vitamin D because their body isn't really utilizing it effectively. And that includes me, because I've had a lot of health issues. So this study talks about investigating the causal effects of vitamin D and migraine risk. And it looks at randomized methods, which is another great way to do a study. Randomized studies are really good. It looked at 184 independent genetic instruments of serum and vitamin D levels. That means what are the levels in the serum? What are they in the blood levels? What's happening with this particular analysis? So you could give someone, for example, 2,000 milligrams or whatever you give them of vitamin D, but you've got to look at how their body is using it. This looked at summary levels of data as well. So you can do a randomized trial and then you can look at summary levels and then you statistically analyze them. That's one of the things I've done in my career. This particular one did the randomized study, and then it looked at 3 studies with migraine cases. One of those studies had almost 49,000 patients. The other had 29,000 almost, and then the other 10,500 cases respectively. The 2 sample MR studies showed genetically determined increased circulating vitamin D levels associated with decreased migraine risk. That means when the vitamin D in the serum was continuously circulating and being used, it had a lower risk of migraines, which I think is very important. And that's why I said, give yourself time for the vitamin C levels to go up. One of the things I love is that we have vitamin C and vitamin D, but we also have vitamin K in some of our formulas. So we know that they're all working synergistically together, because some people's bodies will not actually use vitamin D effectively unless it has vitamin K as well. So that's what's so important about using the different products and using them on a regular basis. If you look at the bottom line, it talks about the role of serum calcium in mediating the association between vitamin D and migraines was negligible. And basically all that means is it really was the vitamin D. Like you could look at our collagen and colostrum. I've told people, there's been a couple of patients that I was on the phone with their doctors and they tried our protocol and it didn't work. And then they added Give Me Back My Youth, and then it did work. Again, that's just an individual case. Most people do not need that to really impact their migraines, but some people do. And if you look at this overall study, it basically shows if you can have the vitamin D, just the vitamin D, and it's working in the serum. And again, a lot of people have to have vitamin K with that, just because that's how their bodies metabolize it. Then it looks like the migraines are decreasing. Some are even just go away and they don't occur. So there's a lot of different studies in that area that really do show these types of references. The next one talks about magnesium, the next study. You guys, I can't talk enough about magnesium. People think that it's just magnesium, right? Like it's just zinc, it's just magnesium, but all these things are really important to your body working. You can understand this if I say you have to have water, everyone understands that. But magnesium is an important part of everything that we do. And it's important for our bodies and the ions of our bodies and the circulatory system and the P450 pathways, IL-2, IL-4, all the different pathways in our body and the neural transmitters and the neural pathways and tubes. Magnesium is very, very important. When you have magnesium deficiencies, it causes neurological complications. We know that mothers that don't have enough magnesium can actually impact their children and the growth of their children while they're in their stomach. It's related to basically the cerebral spinal fluid, the CSF, which is really important. So you've got to make sure that you're keeping magnesium in your system. And I want to stop and I want to talk about this too when it comes to heart issues, pulmonary aneurysms, thrombotic events, all those different things. And thrombotic events are where you just have, basically a blood clot. You can have micro thrombotic events too that are small, basically bursts of the blood clots. Magnesium is really important, and you have to have significant magnesium in the body, which is why it's important that we have that in our products. And it's one of the reasons that I integrate that into a lot of the products that we have, because it's important to the overall body functioning. If your neurotransmitters and your pathogenesis aren't working right, then the pathogenesis of migraines and autoimmune disorders will take over. So you've really got to support the neuron and electric potential of the body. Magnesium is one of those things that's important to the energetic levels and the spiritual levels of your bodies. Your pineal gland, your pituitary gland, your neurotransmitters do not work right if they don't have enough magnesium or enough vitamin D or vitamin C. So these are basics that are needed for you guys to take every day. But when you're approached by a virus or bacteria or other things, it makes that need even more important. So remember that during this time, because we're in October right now, getting ready to go into November and December, and it's really important that you have these things in your body. The next one, we're going to talk again about vitamin C and bark extract, and how important it is to have different types of formulation that can act basically prophylactically. I can't say that right. You guys know how bad I am at saying words. But to really have long-term results of migraines. I want to say this, though, because I'm talking about long-term approaches to migraine treatments. I want you guys to know, when you have a fast-acting migraine or something that you notice right then, increasing things like the Restore, increasing things like the natural barrier support and the immune defense shield have been known to help some people in the case studies that we're looking at. So don't just give up and think, well, I'm having a migraine, I can't help my migraine right now. Again, you turn off the computer, you turn off the television, you get in a really quiet place. And I know most of you guys know this. You relax, you meditate, you close your eyes, and you really focus on your own body. I think that's the key, is really focusing on you to try to get through that period. And everything else, what other people are saying, that's noise. You've got to get your body back to where it should be so that it can operate appropriately. And that, again, is very important. This looks at 150 milligrams vitamin C daily for 3 months. It looked at an assessment and questionnaire. A lot of people have migraine disabilities. Some people actually take leave from work because of the issues that go along with migraine. So this looked extensively at work, school, social activities, and everything that was involved. It looked at 3 months prior to treatment and medications as well, so that you could look at what was happening over this 3 months to 12-month period. And what that meant is they were looking at what's happening in their daily lives. What are they taking? What's going on at home? What's going on at work, at school? What's going on socially? They wanted to look at everything, what was happening, as well as what migraines impacted. So I think this is important to show you guys, because migraines do impact people's quality of life. They impact their happiness. They impact their emotional, mental well-being, as well as their physical well-being. This is not something to ignore. This is not something to not recognize. This is something to treat and to support your body. And I'm very thankful that we have these products at Root that have been able to help so many people. In this method, it talks about how these people were treated. Patients who were responders were assessed for migraine impact using this questionnaire every 3 months for 12 months. So they went over a year, right? And they looked at what was happening again with the migraines, what was happening without the migraines, and how they were being treated and how this was implemented. 29% of the patients, so 58%, showed improvement in MIDAS score. So that means they showed improvement on their migraine disability assessment. They did better. They weren't as disabled. They were able to have better activities with work, school, social, everything that was in their life. And that's really important. The number of headache days and headache severity scores over the last 3 months of treatment, again, 58% improvement. That's pretty big. I mean, I think those of you on the call that have migraines would agree with me. That's a huge improvement from dealing. If you can go back 60% on what you're dealing with migraines, and you only have 40% of it, that's a huge improvement for your life. The mean MIDAS score significantly improved from 30.3 days at baseline to 14.4 days. That means that improvement went from 30 days to 14 days. So again, you're dramatically decreasing what's going on with these migraines in this particular study. And this is a really good study looking at what happens with patients. And I love this study because they're looking at overall every aspect of their life, with migraines, without migraines, how it's impacting, and then what the patients are on. The mean number of headache days significantly reduced from 47.9 days to 25.9 days. And the mean headache severity reduced from 8.1 out of 10 to 5.6 after 3 months. Again, if you look at this, you have significant improvement in what's happening with the migraines. The responders continuously took the bark extract and the vitamin C in combination for 12 months and experienced ongoing migraine relief with more than 50% reduction in the frequency and severity of the headaches. I know that I'm going fast. I know I'm speaking in English. I know that we're translating this into other languages. It's really hard when you have these studies to get into all the facts. So I could summarize this. So let me do this, Roland, for everyone. The summary is the people that were on the Radiata bark extract and the vitamin C for a period of basically 3 to 12 months did significantly better. And the significance is anywhere from 50% to 58%. So that's huge. The reduction in migraines happened over different periods of time. And if you really look, you can't put everything into this study because this just goes over the methods and the results. But the conclusion is that antioxidant therapy used in the study was beneficial in migraines. That's the conclusion. That when they used antioxidants, which our products are antioxidants in different areas, it reduced the headaches, frequency, and severity of migraines. And it helped treat the migraines. And I think that's what's so important. So again, let me summarize this. And let me say it slowly. The data suggests that antioxidant therapy used in this study was beneficial to the treatment of migraines, and it reduced headache frequency and severity. That's what we're hoping for. That's what we're trying. Even with autoimmune disorders, most autoimmune disorders and diseases are diagnosed by symptoms. I don't know if you guys know that. When you go into a doctor, they say, what are your symptoms? When do they happen? How do they occur? And then you diagnose someone. You can look at series of tests, but things like migraines, that doesn't work because we can't see it. Now, there is certain mapping on thermography and then other ultrasounds and MRI. And we have some new devices coming out, which are looking at electrical impulses in the body, which show and point towards migraines because it shows a disruption in what's going on in the body. And it also shows basically with the neurons and the electricity of the body, there's like a clogging point where things aren't going through for nutrients and minerals. But you're really looking at the patient saying, do you feel better? Are you doing better? And we've had a lot of great results because of the different products we have. I point again for me to Relive Grains and Restore. And again, I want to point out to everyone, the natural barrier support seems simple, but it is very important. And then also the immune defense shield as well. And of course, your clean slate, as far as cleaning things out of the body, is so very significant to the overall success of the body. You have to clean the body out first. And I didn't talk a lot about clean slate on this call, but again, cleaning things out, cleaning the heavy metals out, supporting the body, that's all very significant. I want to talk to you guys about what we are doing in the science department here at Root. I am meeting more with doctors. We have more depth meetings all over the world when I go in, which are focused predominantly on science and on nutrition and what we can do to really help people throughout the world. This community is so very important. I'm one voice. I fail every day. I make a lot of mistakes. I am an ambassador for you all. I know that when I speak my perception and my reality because I'm one person. You guys each have your own reality and your own perception, and that's what makes the world so great. We have so many people with different religious beliefs and different political beliefs, but I want to encourage this community as a scientist and as a woman and as a businesswoman as well, a business person, to remember that the world does need these products. People understand when people need an antibiotic, when they get a bacterial infection. People understand when someone gets a virus that they're sick. I want you guys to understand by giving people natural products, you are supporting their bodies. You are giving them power. You are giving them their life back because you're giving them the ability to support the inside and the outside of their body so that they can make better decisions, so that they can vocalize who they are and be who they are to the world. And that's extremely important. Having a world where everyone thinks the same or everyone's body has the same DNA or same genetics is boring. Look at it like a gift that your genetics are different, that your body's different, and then learn your body, support your body. Anti-aging is important, and that's what I'm known for in a lot of circles, but that's not really what I do. My goal is to support this community and the world in nutrition and health so that we can continue to thrive when there's things that are happening where we're talking about depopulation. I'm talking the opposite. I'm talking, how do we get the people in this world to live better, to live stronger, to have the best impact, because each person in this world is so significant and so important to the success of what we have on this earth. And I want you guys to know that any talk I ever do, any place I ever go, this is the same message that I share. Most companies like Root are not taking stances where they're all over the world and they're impacting the world like we are. We're a different community. We are here for worldwide solutions that have to do with science, but they also impact the environment, they impact animals, they impact people, and they impact governments because of what we do. We've got to continue doing it together. We've got to support each other. That doesn't mean we're always going to agree with each other. That means we have to love each other despite our differences and not because of our strengths. And I want to thank everyone in this Root community, because I feel your strength. I feel your power. I feel who you are much more than I feel myself on many days. So when I'm tired and I don't have the ability and I just want to come home and I just want to see my family, I think of all your families and all the things that we can do together and that we are doing together. And that's what makes the difference. So those of you out there that have migraines or have friends that have migraines, don't say it doesn't matter. Don't say I have headaches too. Understand that this is debilitating and this can affect a lot of people, and then share the protocol. Then share the knowledge with them that each person is different and that they have to learn their body. But by giving your body the nutrients and minerals it needs, especially the right nutrients and minerals after you clean the body out, the body starts to thrive even more. Maybe not completely getting rid of migraines, but by reducing them by 40 to 50%, that's significant, right? And that's what has to be our goal. And if we can completely get rid of them, of course, I'm happy, but sometimes that doesn't happen overnight. We will be launching things that have to do with weight loss. Some of you guys have reached out to me and asked me for the ingredients and exactly what we're doing in that aspect. And I will be getting those to you as soon as I can. I'm home for a day. I leave again tomorrow. But I am actively trying to respond to as many of you guys as possible. And I do want you to know I had a call this morning planning the Germany event, which will be the 14th of January, planning the Romania event with many of your leaders, which will be the 12th and the 13th. And just excited to be able to share the future of the new year with you guys. But before the new year's is over, we will be launching the clothing so that it's in the comp plan. We will also be launching different products, and we're reworking the skincare line so it looks even more beautiful and so you guys have even more options. So thank you for your time and thank you for your attention today. I appreciate everything you guys are doing. And I want you to know that there are solutions, there are things that we can help people with. So hopefully this is something that will help you guys with your customers as well as with your own lives. Thank you so much. I hope you guys have an amazing rest of the day. Thank you, Roland. As always, you're amazing. I have to see everyone. I love seeing everyone on the picture. Thank you, you guys, for being so great. It's good. Hi, Verna. It's good to see you all. Hi, Alfred, Sissy, Melanie. So good to see everyone. Bye, you guys. Have an amazing day or night in Europe.